Thank you, Deputy Speaker. And I rise today to raise the issue of healthcare on behalf of the people of the Lalor electorate, because they, like me, are confused. They're confused because when they compare the primary health networks with Medicare locals, they can hardly get a cigarette paper between the two. From the Primary Health Network written on the Department of Health website, we read that it will be working directly with GPs, other primary care providers, secondary care providers and hospitals. Care will be better coordinated across the local health system so that patients requiring help from multiple providers receive the right care in the right place at the right time. PHNs will work with other funders of services and purchase or commission high-quality, locally relevant and effective services for groups of patients at risk of poor outcomes. All highly valuable work. Then if we compare what was written about Medicare locals, this is from a press release from the Minister for Health, Nicola Roxon, in 2011. The new Medicare locals will have the important role of working with GPs, nurses, allied health professionals, Indigenous health organisations and local hospital networks to identify and respond to gaps in local health services and help patients and professionals navigate our complex system more easily. So my question is, what is the difference between a Medicare local and the new primary health networks? And the answer, I fear, is not a lot. There is, however, one significant difference. The word local is no longer a feature. It is disappointing, Deputy Speaker, the Abbott government is closing Medicare locals at a cost of almost $200 million, money that could be better spent providing health services. Medicare locals were established after careful research, significant input from those who are expert in the provision of health services. The model is sound and the only reason for closure, it seems, is political. Now, I have met with Southwestern Melbourne Medicare local several times across the past 12 months, and I've found them to be very well informed. In fact, their knowledge of our current health services and the features of health locally is outstanding. They understand the local issues and they're doing very important work. My question is, really, with the new version of Medicare locals at the cost of $200 million, when you look at the map, the difference that you see quite clearly is that in metropolitan Melbourne, the three new super Medicare locals all meet in the CBD of Melbourne, and my concern is shared by those locally. Does that mean the head offices will all be in Carlton and North Melbourne and the local will be gone forever?
I thank the